Thank you, Mr. Chairman. I know one of the comments that's been made here a couple times has been uncertainty. In small business world, it's hard to plan if you have no idea what the future holds to be able to make the kind of investments and sort of proper plans for your business to grow and be successful. My understanding is that there's probably about 700 rules to be yet promulgated. Mr. Holzhagen, is that pretty close? I mean, I'm sure you probably know more than that's about half of them. Still a good ballpark figure. Okay, so that would be certainly another reason for the uncertainty among a lot of folks. Also, a while ago, I know there was a comment made with regards to 97% of the small businesses being under 50. Let's take that number though and break that down. Let's say, for instance, that the average small business is 10 employees, and you have out of 1,000, that'd be 970 employees that would be covered by that. Or 97 businesses times 10 is 970 people you're talking about. If the other 3%, which is the 50 to 500, would be an average of 300, you're looking at 900 people being covered. So you're in the ballpark of 50%, but let's just say for talking or be conservative, let's say only 40% of the employees are impacted. We're talking about people now. We're not talking about companies or insurance. We're talking about real people whose lives are being affected by what's going on with this health care bill. Had a gentleman in my office yesterday who has a Taco Bell franchise. He's not going to allow people to have overtime. He's going to put them underneath the 30-some hours that it takes, and they're either going to have to do one of two things, either learn to live on less or get a second job. This bill will have a tremendous impact on people's lives, not just their health care, but on their lives as well. And that's the point I want to make. I know that in your testimony, Mr. Holzhagen, you talked about young people getting out of the market and having an impact on the health insurance as well. I know that we have in our packet here February 17th article of the New York Times with regards to a lot of small businesses going to be self-insuring. And that would certainly impact, I think, the pool of how this all works. Have you, Mr. Golden, Ms. McQueenie, and Mr. Trindle, have you thought about self-insuring at all, looked into it at all, or is this something that you may have to consider down the road as an option?
I have not looked at self-insurance. I can't imagine a small business even conceiving of really having self-insurance of health care, because the cost of health care, one employee's major incident would wipe you out. So what we have looked at, and I've always thought might be more efficient than what we have been doing, I've been paying 100% of the premium for our employees. I now realize that's probably not very smart. I've been part of the problem. But what we would like to learn more about is health savings accounts and high deductible insurance. I do think it's very important that as many humans in this country get involved in the decision making on health care. It's the only way you can get the cost down.
If I'm not mistaken, I think health savings accounts went by the wayside with this bill.
I know that.
Ms. McQueenie.
Actually, we do have a health savings account. I have a $5,000 deductible before health insurance pays anything.
My question, though, is have you considered self-insurance?
I would definitely not consider that.
Okay. Mr. Tyndall?
No, just, as the liability that you would incur, or the potential liability, would put you out of business.
Okay. Mr. Holzhagen, can you kind of put a face on this of whether this is a good deal, bad deal, what size business you thought would be something that would be impactful on, or where everybody else should go with this? I'm sure you probably got some ideas.
One of the concerns I had when the bill first passed, I'll have to go back and review, see if the rulemaking changed it, is that you could actually opt to self-insure when things are going well, and then given guaranteed issue, a firm could then jump into another product if they got someone in their firm who got sick. And so what you'd end up with is self-insured, low-cost people with very high-cost small firms in the exchanges. And those dynamics remain to be played out.
Right. Well, my time's about up, and I just want to make one more point here. I saw in some of the testimony here that I think is Mr. Holzhagen that the cost-benefit analysis of the paperwork here is a 3-to-1 negative, which is kind of not surprising, I guess, because it's a government program. But it's interesting. I had a gentleman in my office yesterday, as I was saying, and with all the paperwork, the fire marshal came in and cited him for all the paper in his office. So just another problem to deal with. Thank you, Mr. Chairman. I reel back.